The global effort to vaccinate people against COVID-19 began in early December last year. Since then, more than 40 countries have started administering coronavirus jabs among their populations. On Zoom in Africa today, we take a look at the latest development on the COVID-19 vaccines distributions among African countries. First, let's start with the global overview in administering coronavirus jabs to the people. In total, the world has applied 23.75 million doses of the different coronavirus vaccines on the market. Most vaccines require 2 doses to generate the entire immunization, so the total number of people vaccinated can be around 11.5 million. Israel is leading the world in terms of its vaccination rate, with nearly 20 people in every 100 having received a dose, according to data compiled by Our World in Data, a research website affiliated with Oxford University. That figure is significantly higher than any other country in the world, an effort which has been attributed to the country's digitalized healthcare system and the government's early success in purchasing enough doses of the Pfizer and Moderna vaccines to cover the whole population. The United Arab Emirates has achieved the second highest vaccination rate at 8.98 per 100 people, while Bahrain comes third at 4.25. The United Kingdom, which became the first country to administer a coronavirus vaccine on December 8th, had administered 1.91 jabs per 100 people by January 3rd, while the United States had administered 1.79 doses by January 7th. Our World in Data recorded the number of people who received a first dose of COVID-19 vaccines. The vaccination data illustrates that rich and middle-income countries have secured almost all the available vaccine supply to date. The country that has applied the most vaccines has been China, with 9 million doses of the immunizer originating in its own territory. In second place is the United States, with 6.69 million doses of the vaccines originated by Pfizer and Moderna. Israel ranked third with 1.8 million doses applied, followed by the UK with 1.32 million doses, the United Arab Emirates with 1.09 million, and Russia with 800,000 doses of its Sputnik V vaccine. The Latin American country that had applied the most doses of the coronavirus vaccine is Argentina, with 107,542, while Mexico has implemented 74,794 doses. The rest of the countries in the region hope to start their vaccination campaigns before the end of the first quarter of 2021. The world is approaching 90 million confirmed coronavirus cases this Sunday, with 1.9 million deaths and 49.8 million recovered. In recent days, several countries have had to re-implement strict isolation and quarantine measures in order to mitigate the second wave of contagion of the virus that came with force due to the different variants in the COVID-19 strain. African countries will have to pay between $3 and $10 per dose for COVID-19 vaccines secured by the African Union. A draft briefing has shown, raising concerns that countries will need to take on debt to protect their populations. The UK is helping Kenya prepare for a rollout of COVID-19 vaccines. British Foreign Minister Dominic Raab said on Wednesday, January 20th. But questions are being raised not about the technical, but the financial burden countries across Africa face to protect their populations. Kenya has ordered 24 million doses through an African Union initiative, which aims to supplement those being provided through the COVAX Global Vaccine Sharing Scheme. The AU fears that COVAX supply may not extend beyond frontline healthcare workers. A draft briefing prepared by the African Export-Import Bank shows African nations will pay between $3 and $10 per dose to access the AU's 270 million COVID-19 shots. And while those prices are heavily discounted compared to what is being paid in wealthier parts of the world, some experts worry that countries already grappling with the economic impact of the pandemic will have to shoulder more debt. According to Tim Jones, head of policy at British charity, the Jubilee Debt Campaign, no country should have to take on debt in order to pay for the vaccine. The document shared with Reuters by two sources provides the first public details on the prices manufacturers are offering the continent outside COVAX. More in this report.
The UK is helping Kenya prepare to roll out COVID-19 vaccines, British Foreign Minister Dominic Raab said on Wednesday.
The UK has provided technical assistance to the ministry.
But questions are being raised not about the technical, but the financial burden countries across Africa face to protect their populations. Kenya has ordered 24 million doses through an African Union initiative, which aims to supplement those being provided through the COVAX Global Vaccine Sharing Scheme. The AU fears the COVAX supply may not extend beyond frontline healthcare workers. A draft briefing prepared by the African Export-Import Bank shows African nations will pay between $3 and $10 per dose to access the AU's 270 million COVID-19 shots. And while those prices are heavily discounted compared to what's being paid in wealthier parts of the world, some experts worry that countries already grappling with the economic impact of the pandemic will have to shoulder more debt. According to Tim Jones, head of policy at British charity the Jubilee Debt Campaign, no country should have to take on debt in order to pay for the vaccine. The document, shared with Reuters by two sources, provides the first public details on the prices manufacturers are offering the continent outside COVAX. The companies involved, Pfizer, Johnson & Johnson and the Serum Institute of India, did not immediately respond to requests for comment. How much each country is offered is determined by population. To take their full allocations, Nigeria would pay roughly $283 million. Cash-strapped copper producer Zambia would have to find $25 million. Last week, AU Chair and South African President Cyril Ramaphosa said arrangements had been made with the Export-Import Bank to support member states who want vaccines, and the document said countries can pay back loans over 5 to 7 years. The bank declined to answer questions on the terms, saying the briefing was a draft and meant for confidential discussion by a team from the AU. That team also declined to comment. John Nkengasong, head of the Africa Centres for Disease Control, said the prices for the AU vaccines are comparable to those available through COVAX.
U.S. President Joe Biden will ban entry for most non-U.S. citizens who have recently been in South Africa in a bid to contain the spread of a new COVID-19 variant. That's according to a senior U.S. public health official who told Reuters. In a CBS interview on Sunday, Biden's top COVID-19 medical advisor, Anthony Fauci, said he was concerned that current vaccines may not be effective against the South African variant, which raises the prospect of reinfection. The South African variant has not yet been detected in the U.S. It's 50% more infectious and has been found in at least 20 other countries. But the U.S. has detected a more contagious UK variant, though current vaccines appear effective against it. On Monday, Biden reimposed an early ban on nearly all non-U.S. travelers who have been in the United Kingdom, as well as Ireland, Brazil, and 26 countries in Europe that allow travel across open borders. More in this report.
Let me be very clear. Things are going to continue to get worse before they get better. The memorial we held 2 nights ago will not be our last one, unfortunately.
We now take a break. We have more when we come back.
Millennium TV. Millennium TV. We mean business.
Ya ndine Matthews Mandandi ya ninkara kuchiranga ya ndine artist sta painting ma painting ya monga memonera ya na recycling cans of Zambia. I think what 200 main bang out. Yeah, so sito yanga nayamba papita ma years months 8 years. That I think more than 8 years. Nenzochita neka practice. Yeah, nenzochita practice, but nikambeche in short ni talented. Uriba mena ananifunzisa yani. Nimapanga ma flowers, frame release, ma Christmas flowers. Nimapanga na ma mobiles, ma giraffes, tunyama, butterflies, tunyoni, isomba, tukusiana siana. Yes, from tiny cans. They are main matu pagira. Na ma paintings, master art ya ma paintings. So pangono wapeza kamena ako waendo tanda zila family and support my children at school.
Welcome back. You're still watching Zoom in Africa. South Africa healthcare experts are warning that the government's lack of a clearly communicated plan to administer COVID-19 vaccines risks causing a supply crunch and infrastructure bottlenecks. With around 1.34 million total cases and 37,449 deaths as of Monday, South Africa is by far the African nation hardest hit by the pandemic. As the second wave of infections grips the country, authorities have come under fire for the perceived slow pace of vaccine procurement. The government has said the first vaccine doses will arrive in the country by end of January, and South Africa will aim to vaccinate 40 million people by the end of 2021.
I don't think that target will be met. And I just think, when you just run the numbers and work out how often you have to be vaccinating people and how many doses you need to be giving per day, and the enormous infrastructure challenges and the logistics challenges, the absence of a finalized plan currently, and the fact that even far better resourced countries than us have struggled immensely.
The creaking public healthcare system was struggling even before the pandemic. So experts say the vaccination effort will require a plan to coordinate with private health services, pharmacies, supermarkets, major employers, and non-governmental sectors. Those groups, however, are still awaiting direction from the government. On Tuesday, January 19th, the government released a statement saying a national committee will oversee the vaccine rollout in both the public and private sectors. However, it did not say when the rollout would start, how distribution and storage logistics would be managed, or who in the private sector would be brought into the plan. The Health Ministry did not reply to an email sent on Monday seeking those details. Experts say it is worrying that the government has not yet shared its detailed plans with the public, nor some of the biggest private sector players, who they believe should already be part of the exercise.
I think it's just fair to say, when you look at other similar things, in this country, I don't think we have a strong reputation for great management of big projects. I don't think that's unfair to say, and I think that's something which we need to bear in mind, and when we're dealing with this vaccine issue. But I do think, like I said, that the most effort that's put onto this, and the most pressure, frankly, from every group that's put onto making sure this is a success, will be measured in success in terms of lives saved. So it really is the most crucial thing to get right. I don't think we'll vaccinate 40 million people by the end of the year, or even 20 million people by the end of the year.
South Africa immunizes around 5,000 babies daily for diseases like measles and diphtheria as part of what is currently its biggest mass vaccination scheme. To reach its COVID-19 vaccination target, however, it will need to administer some 150,000 vaccine doses every day for the next year. A program of the scale required will need to manage reams of data on who must be vaccinated, who has received a dose of the vaccine, and who still needs a follow-up shot. According to the government's statement on Tuesday, the vaccination system will be based on pre-vaccination registration and appointment systems, but was scarce on details on when and where people can get registered and get vaccinated. The vaccination drive will also require vast cold chain infrastructure at a time when South Africa is suffering from regular power cuts, as well as a plan to deal with unprecedented amounts of biomedical waste. One of South Africa's big pharmacy chains told Reuters it was ready to offer the use of its vast distribution networks, but was awaiting clarity on how the government's program would work.
The biggest challenge for us is the health workers. So obviously if you can't vaccinate if the health workers is not available, so we believe that we will keep our health workers and we'll keep them safe and healthy. And then obviously if we don't get the volumes of the government, that's basically the two major challenges in the COVID vaccination.
Health experts say such private sector support is encouraging, but that without a detailed government blueprint, delays in getting life-saving vaccines to South Africans will be inevitable.
4 big facilities, warehouse facilities with cold storage. We've got all the couriers, the trucks with cold chain that we will, courier to our facilities to administer the vaccination. And we would even rent more cold storage if we get a lot of vaccines. We're able to extend the distribution, extend the keeping of the vaccine, and extend the administration.
Medics in Nigeria have been exhausted waiting for COVID-19 vaccines as the country requested 10 million doses from African Union last week, Monday. One of the doctors on the front line, Oluwajoba Orage, was bracing himself for the week ahead on Saturday. Another long line of coronavirus patients at Abuja's private EHA hospital, and another long wait for news on a vaccine. Europe has been inoculating its people since early December, but African health authorities say it could still be weeks, even months, until anywhere on the continent gets its first shots. Every day, said Dr. Oroge, cases have been mounting, stocks of protective gear have been dwindling, and the number of his colleagues with the energy and health to keep fighting has been falling.
The cases will continue to rise if we don't have a vaccine to stem things, a vaccine to even produce, to give us some herd immunity. So that continues to mean more work stress, more mental stress, more stress on all the resources that I, as an individual, and the facility has to offer.
A nurse working on the front line, Antonia Obioma, has been to over 25 COVID-19 cases at the private hospital.
From treating patients with medical conditions, we're now treating patients that actually have COVID-19. So it has been challenging because this is a new illness. So we don't even know what to expect when we come to work.
More than 2,600 Nigerian physicians have contracted COVID-19 and dozens of them have died, said Dr. Adetunji Adenekan, chairman of Lagos State branch of the Nigerian Medical Association.
We have depleting numbers even before this COVID-19 pandemic through brain drain. And even during this pandemic, a lot of doctors have left the shores of this country. So we are depleted every day by the minute. And yet we are combating a lot of cases. As you see that, as it is now that the cases are rising.
Nigeria Health Minister Osagi Ehanire said last month he was hoping to see the first vaccines arrive through the global COVAX scheme in January, though he gave no details on precise timing or which shot Nigeria would get. African states have accused richer regions of cornering most of the supplies. The head of the World Health Organization said last week the world was on the brink of catastrophic moral failure when it came to sharing out shots. Confirmed cases hit daily records across Africa this month, and a second wave is infecting twice as many people per day as the height of last year's first wave, according to Africa Union's Africa Centers for Disease Control and Prevention. Nigeria has reported 110,387 confirmed cases and 1,435 deaths, though African officials have warned that low testing could mask more cases. Privately, some doctors say they worry that when vaccines arrive in Nigeria, they will go first to the rich and powerful.
Looking forward to that, and I hope that it will come to us as soon and as quickly as possible.
Cameroon is getting ready to host the African Nations Championship, one of the first sports tournaments to be organized in Africa since the start of the global coronavirus pandemic. The tournament, restricted to footballers who play in their country of birth, will be a full-scale test for Cameroon ahead of the Africa Cup of Nations to be held in January of next year. In late 2018, the Confederation of African Football, CAF, decided to strip the right to stage the 2019 Africa Cup of Nations finals from Cameroon because of delays in preparations and security concerns. It was supposed to host the tournament in January of 2021, but it was postponed by 1 year when the COVID-19 health crisis saw football suspended across most of the continent. As teams train ahead of their first game, most participants say they are unsure of how to avoid catching the virus.
With a few teams like Uganda, like Morocco, like Zambia, and I've also spoken to a few CAF officials who are present here in the city of Douala, and all they keep telling me is the fear of the unknown. They don't know where the virus is. Obviously, the virus is everywhere, but of course, they don't know where they could catch the virus. And I think that it's a call for concern. It's really a worrying situation for these people who should have been very free if the coronavirus pandemic were not ripping through, the African continent.
In Douala Bepanda Stadium, authorities will let a limited number of fans attend games. 1 in 4 seats will be opened, and Rene Kache Echu believes Cameroonians are getting excited again about their country hosting the continent's major soccer tournaments.
Cameroonians are living their dream. Remember, this competition was shifted to a later date, and that excitement had died down. Now that Cameroonians are sure and are aware that the competition is going to be taking place at home, I think the excitement has come back.
The streets of the coastal city are mostly quiet, says Felicia Nga, a vendor who sells soccer merchandise, but he hopes to see a large turnout as the tournament starts on Saturday, January 16th. One local fan says he is confident everything will go well despite COVID-19 fears. Limbe, located in the English-speaking region, is one of the host cities. Separatist groups have warned on social media that the safety of the teams playing in the city cannot be assured given the region in crisis. Officials in Southwest region say measures have been taken to ensure the safety of fans, players and officials.
Pour le moment, il n'y a pas encore l'affluence. On attend d'ici samedi pour voir s'il y aura l'affluence. Pour le moment, il n'y en a pas. Mais sinon, le drapeau passe quand même. Les pays qui sont qualifiés là, on paie quand même le drapeau.
You're still watching Zoom in Africa. We now take another short break.
I'm here at my shop. HP1. I'm advertising my business.
Vitu vyote vikali viko hapa, vinapatikana hapa. Kiba Fashion. Ukija Komesa ulizia Kiba Fashion unampata Komesa.
Vintu vatu muno nvochipa maningi. Mosayope atia just because Komesa awai. Even the shop itself is not all that whereby somebody can be scared. No, vintu vili affordable muno. Mwima dresses, mwima sketi, paima minimo, paima longu, palima dresses, paima jumpsuit, paima babies, the other side.
We are found in Komesa Market, opposite Komesa Police Post. This is Kiba Fashions Wear. Come through, come on.
You are watching Millennium TV. We mean business.
Welcome back to Zoom in Africa. Scores of Malawians who returned from South Africa over fears of hunger as the country battles the second wave of the coronavirus vandalized and burnt a prison facility in Blantyre, where they were kept for days following their arrival. About 40 men were arrested, and footage showed some walking around in chains. It is not clear what caused the destruction. However, a returnee said there was no clear communication from authorities on their release. 36-year-old Kambani Mwale, who lived in South Africa for 13 working years as a waiter, was also part of the arrested group, but was released immediately for not inciting violence. Malawi is processing hundreds of returnees and from South Africa who are struggling to survive the country's tough lockdown regulations. Before releasing the returnees, the Malawian government is mandated to test every person to make sure they don't spread the virus across the country. A COVID-19 positive returnee, Kefa Msafili, told Reuters that she's happy with the process. As of January 13th, Malawi has reported close to 10,000 COVID-19 cases with 275 deaths.
Ndiatamba kutiyeza anatuza kuti tidikire kufika mmawa kuti ndi pamene sopati pechani matati. Then titafika mmawa tinapeza kuti anatuza kuti tidikire mpaka 9 o'clock. 9 o'clock ija tinadikira mpaka zonse zija sizinabwereso. Matasi kuti amene timayembekeza kuti akhoza kubwera pa nthawi ya 9 o'clock sanabwere. Ya ndiye timakhala kudikirabe. Ndiye titaona kuti anthu aja kuchedwa ndipo sopati tinayamba kukafunsa kuti kodi chimene chikuchitika ndi chani. Ya ndiye ngasimaziwa kuti pakakhala pagulu pamakhala malidala. They
wanted to force their way out, and in the process, it's possible that some of them may have broken out.
Level 5 jana tibeza tinavutika ambiri moti anavutika moti panopa ambiri so akuswaso akantfaya kuti ena machito zinathera mnthawi imene chai ena nene kuti patakhala mwina kapena masiku ochepa ena anayamba kugwira masiku limodzi mwina pa wiki ya komabe ambiri pali pamene ndithu amagwira ntchito amachita ndithu kulandira chabe chithandizo chochokera ku anthu amene mwina kapena amene ali nako kanga chepe kukathandiza koma ambiri analibe nyina chilichonse.
Batipokerera makola anthu pa chipatala na bapolisi na basikilikali tikuwaonga chomene na ivo bali kutichitira chifukwa wakati bakhala pasi boma kuti setafuna South Africa bazakatipime COVID-19 bali kutipima kweneso mali kutipimira tabanyake tasangika nayo banyitu banyake bandasangiki nayo kwendi sitasangika nayo batituma mvipatala vya kuti bakativwire tachipokerera chikuyana wakana kuti para wa munthu warwala wauta kuchipatala ukwena kuti ukapoke mapilisi uchire.
That's all we had for you on Zoom in Africa. Thank you so much for joining us.